I just received my doctor's orders that we're going to be setting up an IV Piggyback with Zosyn inside of it, and it's going to be at 3.375 grams per 50 milliliters. So I have 50 milliliters, 3.375 on the bag, and then what we're going to need to do is infuse it 50 milliliters per hour. So I'm going to have to do a dosage calculation here. So if we want to do it drops per minute. So we have 50 milliliters per hour. And we have grabbed a secondary kit that is 15 drops a minute, or a milliliter, 15 drops per milliliter, and we're wanting to go to drops per minute, so 1 hour over 60 minutes, milliliter, hour, drops per minute, and that comes out to be 12.5 or 13. So 12.5 we can't do half a drop when we're doing the drip rate, so it'll be 13 drops per minute. I'll just show you my calculation there. 13 drops per minute. So we come in, wash our hands, put on gloves before we make contact with the patient, get a new glove. Don't take that off the floor, get a new one. So, I'm going to put some goggles on as well. So first things first, come in, name and date of birth. Okay, thank you. And then I'm going to check, make sure we check our drip rates, and I'm going to close this. So that's closed. And make sure that we do our medication checks. I've already done the medication worksheet for this particular, for Zosyn, to make sure that everything's compatible and that there's no incompatibilities. We've got to make sure that this medication that we have being pushed right now is not incompatible with the medication that we're taking. There are, we need to get a whole new bag and tubing if it is, but in our case it's okay. And I check my labels just to make sure that everything is okay and everything looks good. First things first, I want to check for signs of pain, tenderness, any signs of inflammation, infiltration, phlebitis, anything like that. And I'm also going to check the patency of the IV. So go ahead and take my alcohol swab. Cleanse the port. Connect it. Aspirate, and then flush. Okay, so we know that we have a patent IV. Now I'm going to obtain my secondary kit. Checking the tubing for any signs of kinks or damage in the tubing. Everything looks okay. So first things first, I'm going to close the roller clamp on my IV Piggyback. And I'm also going to hang my primary bag lower than my secondary bag, just right up here. Cleanse the port closest to the infusion. Right there, I'm going to cleanse that port. Let that dry, and then using good aseptic technique, I'll connect my Piggyback. So, to be able to back flush, and I'm also going to open the valve up on this guy. So holding this lower, I'm going to back flush the tubing. So I've back flushed the tubing. And now, making sure that my spike stays away from anything that gets touched. I haven't taken off the cover yet, but I'm going to go ahead and remove the cap on my bag. And now I'll remove this part, the cap on my spike, and I will go ahead and spike the bag. Bag is spiked. I'm going to go ahead and squeeze it and fill it to half full. So there's that. Now that that's all set up, since my clamp is down on this guy, I can go ahead and open up this clamp because we're connected everywhere else. Now, this is where I will calculate my drip rate. So, since I've already calculated it out to 13 drops a minute, I'm going to go ahead and remove my watch. I'll bring it up close to you so you can see. Let's bring it down. Come right up here. Make sure you can see those drops. And I'm going to go ahead and calculate this out to 13 drops per minute. It's going to be considerably slower than what we did before. So, and with this one all the way open, I'm doing the wrong one. Let's go down here. So with this particular stopper, I can control the drip rate. So let's see how close we are here. It's a little too slow, or a little too fast. So I'm going to slow it down a little bit. Two. Let's try that. So let's start it. Okay, so the minute it started. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and the minute's up. So there's our 13, so we're about 1 off. And that should be okay. So I'll go ahead and bring this guy back over. So now our medication is being administered. We've done all of our checks. We'll throw away all of our equipment here. And we've done the calculations. Checked for, well, you know, we could assess pain. Everything looks like it's okay.